Hey, welcome back again. We're going to talk about 3 more issues that you can utilize to help with satisfying the needs of your elderly, either family member, parent, friend, whom you have decided to help assist. We talked about 3 previously, and we're going to talk about 3 more. The first thing that we'll talk about today is knowing their medications. We talked about knowing their medical issues, but the other very important thing that you need to know is what medicines are they on. Since these lists change a lot, it is really important, especially for older people who are on a lot of medications, to get a current list and to know what they are, to know what people's allergies are, and also to have that list to know exactly why they're taking each one of them. What I have observed over the years is that some people were started on a medication maybe in their 20s or 30s. They just never stopped taking it. Maybe they don't need it anymore, or maybe over time there are side effects from using one of the medicines, so they end up being put on another medicine to help the side effects of that first medicine. So that's called a cascade that can happen. So getting a really good idea about what medicines your loved one or person is on and why they're on each one of them. And then having a conversation with their medical provider about, do they still need to be on each one of these medicines? That can really go a long way. A lot of people I see, being a geriatrician, there's a lot of polypharmacy. So when people are on more than 5 medicines, that it's more risky. When you're on 10 medicines or more, the chances of you having falls or ending up in the hospital or even death is much higher. So it's really important to try to get a handle on that. Number 2 is understanding their disabilities. Okay, and what I mean by that is medical diagnoses are one thing, but actually knowing in the home or where they reside, what are they capable of doing and what are they having difficulty doing. So can they still get dressed safely? Can they still shop and cook at home safely? Can they still see the same as they used to? How is their hearing? Can they get in and out of the home or car or transportation wherever they live? So knowing what their disabilities are is really helpful. And then that will give you an idea to reach when you go to their provider to talk about what resources they may need in order to help them achieve the goals that we talked about previously. And then the number 3 for today is to have a conversation about end of life goals. So if that loved one wants to be a DNR or not, if you're in a state where there is a most form or a post form, these are forms that tell, they're similar to a power of attorney or a living will, but they are very simple. So they're much more simplified. So does your loved one want their heart to be resuscitated or not? These are things that you need to ask them and have that plan in place and make sure that everyone who's involved with their care knows what their wishes are. I'll talk to you all soon.